Welcome to our 11th in the series of Rare webinars, and thank you for joining us, especially on this special day as we celebrate International Women's Day. I'm Nicola Miller, co-founder and creative director at Rare Revolution magazine, and in the background, working on the tech today, is my colleague, a real superwoman, Becky Pender. Today's conversation is supported by our friends at Alexion and AstraZeneca, who are currently championing the voices of women in rare in a great many ways throughout their organisation, including a dedicated Women in Rare edition of Rare Revolution magazine launching next month. So please be sure to look out for that. The focus of today's session is a celebration of women working in rare diseases in science and research, and I am beyond thrilled to be joined by such a stellar lineup of guests today. So please join me in welcoming Wendy Erlia, Global Head of Patient Experience, Patient Advocacy and Patient Insights at Alexion AstraZeneca. Dr. Mariana Rico, Physician, Vice President and Medical Director at America Health Foundation, where she's dedicated to promoting equitable access to healthcare in Latin America. Yale Weiss at Mazi Therapeutics, a company focused on the development of therapies for ultra-rare genetic neurological disorders. And Lara Bloom, CEO of the Ehlers-Danlos Society, who are leading a coordinated research collaboration raising vital funds for research. Hello, ladies, and welcome, and happy International Women's Day. Thank you so much for joining us today.
Thank you. It's great to be here.
Oh, so Women of Rare, let's dive in. I want to get to know more about you and your driving forces. And I'm going to come to you first, Wendy. Thank you so much, firstly, for helping us bring this event together. We're always excited to work with your team. And I think, it's just extra special to do this today. I'm incredibly excited about the work that I know all of your different departments across Alexion and AstraZeneca are doing to really amplify and give weight to the voices of women in rare. But can you tell us a little bit about why this conversation is so important to you?
I can, and thank you for the opportunity. We're excited to be here, and thanks to everyone for joining. This really starts, if you think very big, as part of the global health equity, diversity, and inclusion conversations and all that the discussion that's gaining momentum. Gender inequalities have increasingly become visible, reported, there's a lot of data, they're being acknowledged. And in rare, from diagnosis to access to treatment or care responsibilities, women are faced with several challenges, and this really actually adds to the threat on health and quality of life. When we draw the link to rare diseases, the parallels become additive, and gender inequalities coupled with rarity, complexity, hereditary, degenerative, often life-threatening characteristics of these conditions. It's a big swirl of a lot to unpack here. But why is this conversation so important to me? From a research perspective, what I've observed in all of my time working in rare diseases is the power of women driving science cannot be underestimated, and we're everywhere. So I'm really excited to highlight the work that these women are doing, but also more globally, how can we all come together and do more?
Thank you so much, Wendy. Yeah, absolutely. We are everywhere, aren't we? And Mariana, health equity, as Wendy said, is a really important issue, especially when looking at the experiences of women. Can you talk a bit about the work that you're doing in South America around that kind of health equity piece?
Of course. And again, thank you for the invitation and for having me. It's great to have Latin America represented on such an important platform. So thank you for that. I've been working at America's Health Foundation now for 5 years. I'm based in Bogota, Colombia. And we're basically a nonprofit foundation that works as a bridge between different health stakeholders, including government agencies, the pharma industry, patient organizations, healthcare providers, scientific societies, and the general public. And our objective is improving access to healthcare in Latin America. So basically, everything and all of our initiatives are at the center of health equity and improving health equity, which is such a huge challenge in our region. So rare diseases has actually been one of our main priorities. We do work in other fields as well, but we work with 11 of the largest rare disease patient organizations in Latin America, because we really wanted to make sure that we're all rowing in the same direction and that the efforts that we noticed were kind of being done in each country could be coordinated to maximize their impact. Because even though the policy landscape in Latin American countries is varied, most of the patients are having this, facing very similar challenges related to access and stigma and awareness. So we really believe that coordination here is key. More specifically, in terms of health equity, I've worked with a lot of Latin American experts to carry out consensus conferences that provide information in the context of Latin America, because what we often have to do is kind of extrapolate the research or data from the US or Europe or other countries and regions that are very different from our region. So we've really focused on publishing research on topics related to rare diseases that apply and are directly tailored to the context of our countries, our economies, our political and economic landscapes. So just to mention some of the research we've published related to increasing access to exome and whole genome sequencing, genetic testing, newborn screening, and this is all with a policy focus because as you all are aware, it's very hard to separate the science and the medical aspect from the policy aspect when we're talking about access. And then two publications that I want to highlight. One is on policies for caregivers of people living with rare diseases that we published, and we highlight the experience of Colombia and Brazil, which are kind of the leaders within the region in terms of policy for caregivers. And the reason I think this is very important, especially today, is because we do know that 90% or more of caregivers of people with rare diseases are women. So the impact of caregiving on women is disproportionate, and the whole economy of care is a important issue that needs to be addressed through policies that protect women. And then another one that has been really important is the social participation in HTA processes for rare disease technologies. So we did a consensus conference on that as well, and how we can adapt HTA methodologies to really capture the value based on social participation. And then lastly, we did the first Congress on Rare Diseases for Latin America and the Caribbean last year, and we're holding the second edition this year. And this is a space we created to bring together all types of healthcare stakeholders from the region. So government agencies, pharma, patients. We had 48 panelists from 12 different countries in Latin America, to really have these difficult conversations on how do we make coverage for rare diseases sustainable? How do we ensure access to innovation with the health reforms and the political landscape in Latin America? How do we provide adequate newborn screening, increase education, foster these regulatory environments that can allow for clinical trials? And with health equity in rare diseases, we have to think of how do we bridge the gap, not only between rare diseases and other more prevalent other prevalent diseases, but also for people with rare diseases that have public versus private healthcare, or live in rural areas versus urban areas. So these are all topics that, have substantial challenges and that we're constantly looking to address with our research.
That's really fantastic. And I'm looking forward to diving a bit more later in terms of that collaboration and how that really impactful work can kind of make its way out into other regions. But one thing I wanted to pick up with you, if I can, before we move on, is you mentioned about stigmas. And I feel quite passionately, this is something that I don't think we put enough bandwidth on across rare disease, particularly for women, because I think there are lots of stigmas around genetic disorders and being kind of the carriers of children with genetic disorders. Has that formed part of your work in terms of, understanding how people, how equity happens and how they engage with research and science around cultural stigmas?
Yeah, and I think around that topic, there's still a lot of work to be done in Latin America, just because we do have so many substantial challenges. And unfortunately, I feel like that takes a second kind of position to the other more pressing challenges like access. But I've met women that are living with rare diseases and have just last week or the week before that on Rare Disease Day, I was at a conference with a woman who has SMA, and she's taken on this leadership role to show the person in front of the disease. So I think there is, you know, some momentum picking up on this, and it's becoming more part of the conversation, which I think is important.
Absolutely fantastic. And Lara, as an influential woman in rare, what drives you personally to be such a change maker in this rare disease space? Because I know you wear lots of different hats across here.
Yeah, I think so often it's felt like there was no one else there, and it's that kind of cliche of be the change you want to see. And when I got into this space, it was 14 years ago now, which just feels scary to say, but there was such a need and there was so much lacking, and you wait and you hope that those changes excuse me, will happen, and so often they weren't. And so I ended up volunteering for what was then the UK organization, and then ended up running that, and then ended up realizing that to look at things through a national lens is often like putting a plaster or a band-aid on it. And what I really needed to do was look at things through a global lens to start really healing the wound. And that's when we set up the Ehlers-Danlos Society in 2016 to try and really look through things from that perspective. And it has made a radical difference. And I think focusing on collaborative efforts is essential. You can't do things in silos. Fragmentation is often a killer in the rare disease space, between patient organizations, some healthcare professionals, some institutions. And we've really at the Society tried to trailblaze in that space and prevent that happening. And we've got so many wonderful examples of really successful collaborative efforts that have come out of the years of us working in this space. And I think being a woman and being a woman living with a rare disease, I'm also acutely aware of the challenges that are faced. You know, there's no gender bias in Ehlers-Danlos syndromes and hypermobility spectrum disorders, yet we see many more women that are impacted by the symptoms or attending clinics and seeking the diagnosis much more. And we don't truly understand why that is, whether it is because of a hormonal influence or because of the cliche that men don't like to go to the doctor, or what really is the reason. But we know that it's not really anything to do with the disease itself. So we want to understand more of that. But what we see as a outcome of that is just how many women are told it's in their head, are told that it's anxiety and depression. And we see so many women, you know, self-harming, committing suicide, really resorting to things that are so incredibly avoidable with a little bit of validation and belief, and doctors just listening to experiences and not putting it down to hormones. You know, it's very frustrating, and I see it every day, and it's getting better to an extent, but not nearly quick enough. And it's very frustrating.
I know Wendy and I
I think that Lara just in a very quick introduction synthesized why we're here and how she's an example of why this conversation matters. And I'm moved by your words, Lara, of starting as a bystander and wanting to see what was happening, realizing not enough was happening, and jumping in as a volunteer. And in what probably feels like forever, but a very short amount of time, leading change in the way that you are. And that's what we see in rare disease and with women who are driving this change. So thank you for sharing all of that.
Well, you and I attended that conference last year, Wendy, where we heard some really impactful accounts from young women, you know, kind of early 20s, about their experiences with this kind of medical gaslighting. And actually, it's really stayed with me. It was so profound to see the extent with which it's happening. And also this notion of everything being in the head and dismissed for hormonal, and actually how pain relief and pain management really wasn't factoring in because, you know, so much was being dismissed. And I think it's at the scale of that we do not yet grasp, but I know that certainly has stayed with me since hearing those accounts as to this is a really big issue that needs to be dealt with for women all across rare disease, for sure. And actually even caregivers having been
I was just about to say,
same way.
So often yeah, you know, and it's really not mentioned enough. It's the woman who is the caregiver. And it's often in genetic disorders, the woman who's the caregiver and the person living with the condition. And, you know, power to the woman, really is. It's just a huge feat that women take on so often in this space. And I just don't think that enough recognition is given to that they are often parents, you know, siblings, and living with something themselves. So a lot to contend with.
And we know, Yael, if I can come to you, because I know that you work really extensively with patient communities through all the different roles and work that you do. How kind of important is that work with a sort of lens of working with women as well in terms of drug development and research work? Because we know that historically women haven't been that involved in, you know, trials even, for example, you know, a lot of drugs are not tested against women and their changes throughout phases of life. You know, how important is that to the work that you're doing?
Well, thank you for having me. And I do have a lot of comments to add on to what Wendy and Lara were talking about women that are not being listened to in in scenarios where they are probably the experts, but people do not perceive them as such. But just stepping back to answer your question, Nicola, what's happening in the last few years in the rare disease space is really a revolution. Your magazine is capturing what is happening, the name of your magazine. If you look back 10, 15 years, there were patient advocacy groups that were active. But since the genome has been sequenced, since we moved from biochemical testing to prove that a genetic disorder exists, we're now moving into an era where genetic testing is the way to diagnose genetic diseases. And we moved from gene panels to exomes and now genomes. And this is providing so much information that allows patients to get a diagnosis hopefully faster and to also act on their diagnosis. So if 10, 15 years ago, patient advocacy groups were focused on providing support to their communities and maybe advocating for policy, now everyone is moving towards drug development, not waiting for AstraZeneca and Alexion or Mazi to develop a therapy, but to do it themselves. And we see more and more such groups popping up, starting to fund research, starting to put money into academic groups that will potentially develop a therapy for them, but not being able to take it through all the way to the clinic or to the commercial and space to get the drugs to all the patients. So this is where Mazi comes in. We work with advocacy groups. We support them in their research efforts. And when there is proof of concept, and that's a whole different conversation and a whole different seminar, we take over and take the programs into IND enabling studies and into the clinic. It's really interesting. We've been running training sessions for advocacy groups to teach them about drug development, and what we've seen in the groups that we've been training for the last 4 or 5 years, it's mostly women, mostly mothers that take the next step. And you know, not to belittle the men that do it, it is probably 80 to 90% of women that actually start the foundation, start fundraising, start funding research, and are the proactive spouse in the relationship. And these women are, as Lara and Wendy and Mariana said, these women are either patients or caregivers. Most of them have a full-time job, and they still take on this very, very full-time job of developing, of starting a foundation and develop therapies. So these women are to be applauded and to and we're here to support these women and to help them in their mission. To Lara's point, I just wanted to mention that we see many cases where moms take their kids to the ER and say something's wrong with my child, and they're not listened to because you're just a mom, right? And then cases where women are trying to advocate for their rights and their kids' rights. And I've been hearing it even recently, people talking about these, just women doing something in their kitchen, like starting a foundation in the kitchen, and it's just mom and pop job. It's not. It's a real revolution. Therapies will come out of it. People will benefit from these efforts, so they're not to be ignored.